More than ever, clinicians are making the move into leadership positions. As this movement occurs, there are many ways these new leaders can have an impact on their organizations, not only by addressing workforce challenges, but also by increasing diversity and inclusion among healthcare teams. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly with AHA Communications. In today's episode, Elisa Arespacochaga, AHA's Vice President of Clinical Affairs and Workforce, sits down with Dr. Mohammad Agha, Medical Director of Care Coordination at SSM Health, to discuss emerging physician leaders and lessons to address the clinical workforce challenges.
So, Dr. Agha, just to get us started, can you tell me a little bit about yourself and your own career journey?
Absolutely. I appreciate you having me on the podcast. So, I'm a native St. Louisan by background and went to medical school in a 6-year program straight out of high school, the University of Missouri Kansas City School of Medicine. Then I trained in physical medicine rehabilitation at VCU Medical Center in Richmond, Virginia, and did a musculoskeletal medicine fellowship. Then I decided to come back home to the University of Missouri in Columbia, Missouri, which is about an hour and a half drive outside of St. Louis. And I practiced non-operative musculoskeletal medicine, so seeing patients with shoulder, hip, knee pain, back, neck pain, and did ultrasound guided injections and started to build out an academic career. So was editor in chief of ultrasound guided injection book for beginners, and got involved in my academy specialty organization. So the American Academy of PM&R, got involved there, got involved in the Association of Academic Physiatrists, went through their program for academic leadership, had a 2-year stint as the American Academy of PM&R's Young Physician Liaison to the AMA, so got experience with health policy in that role. And while I was at Mizzou, University of Missouri Columbia, I started getting interested in the administrative side of healthcare. So my patients, they would come in with shoulder pain or hip pain, and we make a diagnosis, but then there would be systemic barriers to them getting better. So things like insurance coverage that wouldn't allow them to get physical therapy at the time, for instance, with Missouri Medicaid, for instance, at that time, or they would lack transportation to get to therapy. And so, those are significant issues that I would not have the ability to impact in my practice. So I started getting more interested in the administrative side after about a year or so. And just started to read different publications like Modern Healthcare and saw that physicians had a significant impact in healthcare, which is not something that we learn as physicians when we go through our training typically. And so after reading Modern Healthcare and seeing their weekly lists, now with the largest MHA programs, I decided to pursue my master's in health administration while working full time. And I obtained that from St. Louis University, and I had a tremendous experience there. So after 5 years of practicing full-time on top of other administrative roles, I decided to make the leap to full-time administrative medicine, if you will. And I joined BJC Healthcare. And about 6 months into that role, COVID hit. And I learned a tremendous amount. I worked with lab medicine before COVID and during the COVID pandemic, or at least the first wave, and just learned so much about how, with lab being such a horizontal type of specialty, learning about how do you procure supplies for a pandemic, for a disease that's never existed in this form in human history. How do you roll out guidelines? How do you utilize your electronic health record to make sure people aren't overutilizing a limited test? Because if our hospitals utilize a test and we run out 2 weeks early, there are all the other health systems in the United States trying to get the same test, and we're going to be out of luck for 2 weeks. So how do you manage that? And then, of course, because there's a lack of information about a new disease, how do you manage people's fears? Because obviously people want to test to make sure that they're safe, but again, you have to manage those expectations in regards to what is appropriate and isn't appropriate with limited resources. And then once, as the first wave matured, then having the data to say, well, here's what we're seeing in terms of testing utilization and results. If we're not seeing positives, but we're burning through tests that other disciplines could need, Could we stop testing? Again, utilizing data to prove our point. So it was a tremendous experience in my time at BJC. And about a year into that, I started to miss practice because I wasn't practicing at all. And so I found an opportunity at SSM Health where I'm at now. And right now I do a medical director of care coordination role. So it's part physician advisor and some other roles. So on the physician advisor side, I perform peer-to-peers with medical directors and insurance companies to get or to discuss medical necessity for inpatient stays, and also work with our physicians on clinical documentation improvement or clinical documentation integrity, I think is a more accurate term. And then I also work with our hospitalist group and our other clinician stakeholders like nursing, pharmacy, nutrition, case management, and others to help with reducing length of stay and readmissions. So, redesigning the multidisciplinary rounds would be one example. And that's something that's just an iterative process to improve communication, especially with COVID and all the stressors that our clinicians have been facing. Really just trying to continuously adapt the processes so that it's helping our clinicians improve their efficiency given all the other demands they have on their time.
Wow, that was a lot of different activities you've done across your career. I'm curious, as you specifically mentioned some of the roles you took on as a physician leader to really work with other physicians and other groups across the organization to really create those pathways and the communication and the coordination. What do you see as some of the bigger challenges in supporting that teamwork and that coordination? I was going to say as we emerge from the pandemic, but as we're still pretty deeply in the pandemic, as we continue to move forward.
Right. It's a great question. I think the biggest thing is really just keeping our teams healthy because they've been dealing with numerous ways for the last almost 2 years now. And, there's been different areas of frustration. So in the first wave, making sure that people had enough PPE, had the tests at the outset of COVID-19, there was no vaccine. There weren't proven medications. So now we've moved beyond that. And now there's frustration in regards to taking care of those who are unvaccinated. And, across the country, we're seeing that this is overwhelmingly a pandemic of the unvaccinated. So one story would be, I was reviewing a chart recently, and a husband and wife contracted COVID, and they weren't vaccinated. And so, one of the recommendations for in that scenario is to get vaccinated, and you get one injection after you contract COVID. But the son stated specifically that he did not want his mother to get the vaccine when she was eligible to do so. And so, when you see examples like that, there's just a tremendous amount of frustration because there are people who could do something to help save themselves, but they're not engaging in that activity. And so, I think the biggest thing for leaders is to show your teams that you're there with them, that you are, helping them to be able to take care of those who are sick. So, you can go down the line of, again, acknowledging the great work that they're doing, highlighting their purpose in regards to why they got into healthcare in the first place, because it's tough when you're dealing with a lot of sick people and you're dealing with cases where not everybody maybe appreciates all the work that you've put in over the last, year and a half plus. Having those forums to be able to demonstrate that you are appreciated, that your work counts, that it's extremely valuable, and just being transparent in your communications with your team. So, along with communication, of course, you also have to back that up with resources like PPE and like staffing. And when there are gaps, acknowledging that there are gaps, but that you're trying to do something about it, because trying to find caregivers has been a challenge across the country. And so being able to say, yes, we are looking for people to fill these vacant roles. We are working on that. Demonstrates to your teams that you're there for them and that you are doing your part to help them as well.
Absolutely. I know you've also talked a little bit about some of the work that you're doing around increasing diversity and inclusion in those healthcare teams. And I think in particular, that's a personal passion for you. So, what are some of the opportunities that especially upcoming leaders can really take to address this issue of increasing the diversity and inclusion in our healthcare team?
Yeah, that's a great question. So there are two forums that I engage in for this most prominently, or I guess most passionately, I think would be a better way to put it. So my specialty, again, the American Academy of Physical Medicine and Rehabilitation has a diversity and inclusion committee. So I've been on that for 3 years now. So we've been working on really getting a strong baseline of who all of our members are, how we're serving our members, and what we can do better. Then we engage in a survey with other specialty societies to see how we're doing. And so we hope to publish that data in the near future. The other venue that I'm heavily engaged in here is the University of Missouri St. Louis has a College of Nursing board, and I'm a board member with them. And I'm also on the subcommittee. I'm the co-chair for the Diversity Inclusion Subcommittee. So one of the tasks that the subcommittee is working on is aligning the diversity and inclusion of our nursing students with the recruiting initiatives that the health systems in St. Louis have for recruiting diverse nurses. And so we're really trying to create this streamlined pathway from nursing school to employer. And so we're in the early stages of doing that with one of the major employers in the St. Louis area. We have 4 systems in town. So, while the work is early, it's very promising, and we are looking to engage our partner more. And, we're looking forward to building a successful pipeline. In regards to opportunities, you know, if you are passionate or interested in diversity inclusion work, this is a great time to be able to engage. So, medical societies are offering a lot of opportunities. There are citywide consortiums. So the city of St. Louis has a diversity inclusion consortium that goes way beyond healthcare. It's across all business sectors in the St. Louis area, and they have quarterly meetings and they share resources as well. I have no doubt that other cities have a similar structure. Specialty societies also offer opportunities like the American Hospital Association with the Institute for Diversity and Health Equity. So there are many organizations who have opportunities, and your workplace will also have diversity and inclusion committees as well. One of the great things is that you don't need to have a formal education to be able to get involved. You just need to bring your perspective, because really diversity, equity, inclusion is about engaging everyone's perspective so you can bring about the best solutions.
Absolutely. And there are a number of resources I know from every angle, but know the ones of the AHA's Institute for Diversity and Health Equity well. So encourage folks to check those out. So, as you talked about in your career trajectory, you sort of made that decision to leap to what some might refer to as the dark side, to the administrative side of healthcare. What advice do you have for those who are considering and are at that same crossroads of how do I impact the broader healthcare system beyond my medical care?
Right, that's a great question. So, I was thinking about this question, and I came up with a few different items for those who are looking to explore the administrative side. So one would be to start exploring various resources. So whether it's organizations like the American Hospital Association, the American College of Healthcare Executives, the American Association of Physician Leadership, really going to their websites and seeing what type of work they're engaged in and what issues they're involved with. Same thing with publications like Modern Healthcare, as I mentioned earlier, Becker's, and many other great publications. Doing a deep dive into those websites and really learning about what they're talking about and what issues they're engaging. Is that something that you enjoy reading about? Is that something that you're passionate about? And if so, then you really have to sit down and figure out your why. So why do you want to go into the administrative side? Is it because you want to reach more people than you can in the hospital, in your clinic? Because if so, I think that's a great reason. Or is it because you're burnt out from practicing and you think the administrative side will be, quote, easier? And, elucidating your why is extremely important, because everybody else will figure out what your why is if you don't. And so if you're in that latter camp of, well, I want to transition to something different or, quote, easier, then everybody will pick up on that and they won't buy into you and you won't be effective. So you really have to, again, if you have an interest, and really understand where your interest lies. And again, if it's more about helping others and being involved in reshaping some sort of structure that is inefficient, and you want to help more people than you can in your current role, I think that's a great why. But again, you have to figure out your why. One question that a mentor asked me once, the first time I met him, was, if you have a significant other, which I do, are they supportive? So if you don't have a supportive significant other, it's going to be extremely difficult to change pathways and go into a different area of healthcare, because there's a lot of work involved. And especially if you're a clinician and you're going from clinical practice to now non-clinical, your value is in applying your clinical knowledge and experience to the non-clinical side, but that transition takes work. And so if your significant other is not bought in with you, it's going to be really hard to be able to make that leap. So that's something you really have to figure out and sit down with your significant other and really talk about that. Another item to consider is compensation. So depending on your role, your compensation could change significantly. So are you comfortable with that? Because some people are not comfortable with that, and that's fine, because they may be in a role that pays them more. Certainly some medical specialties will pay more, and so if you want to go administrative, you're not going to get a clinical salary for the first job, or maybe the first couple of jobs, because you have to prove yourself. You're proven as a clinical commodity, but you're not proven as an administrative commodity. And so, in order to prove yourself, you are a risk. And so, your compensation will reflect that. And so you have to, again, acknowledge if you're comfortable with that type of change in your compensation. Some other things to consider. What is your end goal? Now, not everybody will know that, but if you do have an end goal in mind, let's say chief medical officer, that will help you in navigating what opportunities you should and should not pursue, because there are so many avenues in healthcare administration that you could go down. If you have even a preliminary idea of where you want to end up, then that will help you tremendously in regards to carving out your path. And no doubt that your interests will change over time, but guess what? If you've gone down a particular pathway, you've developed skill sets that you could take to this other trajectory and apply them. And you can even prove, hey, look, when I went down track number one, this was the idea that I had of my end goal. So therefore, I did this level of work. I can do the same thing going to this other track. And so again, because you've planned out ahead of time, that's going to demonstrate that you have foresight and that you have work ethic and discipline to get there. So again, considering an end goal will be very helpful. Are you comfortable with moving? Because you're going to have to move maybe a handful of times for, climbing the administrative ladder. And so again, are you comfortable with making those moves? Because that is definitely something you have to look at. And again, you may move once or twice or more than that. And so are you comfortable with that, if that's what it takes to climb in your career? Consider adding additional formal education, whether that's an MBA, an MHA, an MMM, or other degrees. Now, because again, as I was speaking to earlier, if you know your why and you know where you want to end up, then the formal education will help you get there, because it will reduce that learning curve that you have, because it's a completely new language and you don't have the credibility strictly as a clinician to be able to make that leap. And so again, putting in the work to get the degree will give you a certain amount of knowledge and skill, and it will give you a leg up over those candidates who don't have a degree when you're looking to climb the ladder. And the last point, because I know I've been going on for a little while, is coming to terms with how your colleagues view you. So when you make the transition from clinician to non-clinician, even if you go 50-50, or you say, I really like this administrative work, your colleagues will, maybe not immediately, but they will look at you differently, because you're not, quote, one of them anymore, because you're not doing the work full time. And so that transition can be hard, because you had a certain group that you identified with who does not identify with you anymore, or at least not as strongly. And so that transition period can be tough. And so again, exploring those organizations like ACHE, AAPL, AHA, and others that where you can have a home where there are other clinicians who are on the same pathway as you is extremely important, because that will give you a new home where you'll feel comfortable and you'll get the initial support that you need when you're making that transition. That happens to everybody because you've put in so much time to get the education, get the training, get into practice, and then you're a decade plus into it and you decide that you're going to go into a different arena. The colleagues whom you've identified with can't identify with you anymore in the same way because they don't have those same ambitions. So then you're looking basically at a new group that you're going to be identifying with more strongly. Of course, you still have those colleagues who you've worked with for many years, but now you're going to add a totally different new set of colleagues who you'll have a greater affinity for because you share the same interest. So again, that transition period happens to everybody. It doesn't last forever. Obviously, a few months, maybe more, but just ask yourself if you're comfortable with that along with all the other changes that are going on. Now, I've made a lot of points in regards to, do you have a supportive significant other, compensation, you may be abandoned by the people who you've worked with. So it sounds very scary, but it's really not. It's an exciting journey because you're on a journey to make the biggest impact that you can on patients' lives. That's exactly what got you into healthcare in the first place. And you're having an opportunity now to really scale that up to take care of, instead of, let's say, 20 people a day or 30 people a day in clinic, you're now going to be doing work that affects hundreds of people. And then as you scale, the administrative ladder, thousands of people, tens of thousands of people. And again, if you get to the very top, depending on the size of your system, millions of people. So you're doing great work. It's just that the beginning is a little bit of a challenge. But again, that's where organizations that I've already mentioned are there for you to help you with that transition in your journey.
Thank you so much. I agree. I think it's one of those transitions that I've seen a number of clinicians be challenged by, but if you know what it's going to be going in, I think that helps. So thank you for that really comprehensive answer. I really appreciate it. And thank you again for joining me today and sharing a little bit about your own journey from clinician to clinician leader.
Thank you. It's been great to be here. And just wanted to make one last statement. If possible, I wanted to thank or acknowledge the person who made this possible today, and that's Dr. Leon Haley. So, Dr. Haley introduced us a few months back, and as many people may know, he passed away tragically in late July from a jet skiing accident. But just a short time, he helped, impact my career in terms of the advice he gave me when I spoke with him and introducing us. So being able to do this podcast is directly thanks to Dr. Haley's efforts. So just wanted to acknowledge that. And Dr. Haley, rest in peace.
Absolutely. As a member of the AHA's Committee on Clinical Leadership, he's one of our shining lights, and we will absolutely miss him. And I'm glad he was able to connect us. Thank you.
Absolutely.